Hi, I'm Patricia Greenberg, and this is Eat Well, Live Well, Age Well, a show about aging well, taking care of ourselves as we get older, and living life to the fullest at any age. My guest today is Dr. Peter Chen. He is the Assistant Director of the Women's Guild Lung Institute and Director of the Division of Pulmonary and Critical Care Medicine at Cedars Sinai. With his research, Dr. Chen tries to unravel basic mechanisms of lung injury and repair. His main focus is on how lung epithelial cells interact with other cellular compartments and with the extracellular matrix to regulate inflammatory cell recruitment, lung fibrosis, and cancer tumorigenesis. Welcome, Dr. Chen.
Thank you very much.
That was a mouthful. Mouthful. And the reason I asked you here today is because we're discussing one of my interests is how our bodies work both in synergy and also maybe oppositionally to our environment. And that was kind of the starting point. So for the month of July, we are talking about the elements, air, water, fire, and earth. Maybe fire we're going to translate into sunshine and how it's good for us. But I have so many questions about lung health, and we have a half an hour, so hopefully we'll get through all of them. I think a lot of people hear a lot of myths, as I'm sure you hear all day long in your practice, about lung health and about what the lungs do. So we're going to go back to basics and ask you a very elementary question. What function does the lungs perform?
Great. So, the lungs basically have to get oxygen into the body. All the cells in our body need oxygen to survive and to produce their energy. And so the lungs essentially will help us extract that oxygen from the air into the body. And then also it unloads carbon dioxide from the body. And so with every breath, we're bringing in oxygen and then breathing out carbon dioxide.
Now, how is your lung capacity measured?
So in clinical terms, we measure lung capacity by both spirometry and looking at total lung volumes. And that is something that we have to bring you into our clinics to do. The spirometry essentially is where you blow into a tube as hard as you can, as fast as you can, and we can measure how much you can get out within a second or over the entire breath. And then we can measure the size of your lungs and different compartments of your lungs, basically by puffing on a tube in a chamber. And then finally, the third thing we can measure is how well does the lung actually deliver oxygen into the body. And so in sum, what we are measuring when it comes to lung capacity is three big components. How well do you get air in and out? How big are your lungs? And how well does that lung get oxygen into your body?
So we have different capacities at different ages, or is the capacity one set measure, like with your heart, it's how many beats per minute, with your walking at strides. So with lungs, are there a lot of variables due to maybe a person's size and age, a weight, male, female?
Yes, there are variables. The main variables that really determine your lung size are your age, your height, and your sex. And those three components are fixed components that we can't change. And as we age, your lungs do get smaller over time. But in general, we have plenty of lung capacity left that even with the small decreases that we have over time, there's usually plenty of lung left over, and it's something else that's going to take you.
So there's so much to talk about in terms of capacity with our lungs as we age, which I'm going to get to, but I have some sort of nuts and bolts questions for you. And this is very near and dear to me. I've run 20 marathons and 110 half marathons, and now I do tower climbing. So I'm very conditioned, especially at my age. I'm 60. And a couple of things that I want to ask you about this. So what are the nuts and bolts of conditioning? So is there a such thing as too much exercise? And I guess part two to that is the best choice for keeping your lungs in good shape is more difficult exercise, which would be stair climbing, mountain climbing, heavy weights while you're exercising, or is it just time, just walking more, running more, whatever your sport of choice is?
Sure. So when we exercise, most of the conditioning actually is not to the lungs. It's actually to the heart, the cardiovascular system. And really getting the heart and the body and the muscles of your body ready for that type of load, if it's long term, such as running marathons versus stair climbing, very intense, or any kind of weight training. You can exercise your lungs to an extent. You can get your diaphragm stronger. Obviously, if you go for very intense runs, your lungs, your diaphragm has to work harder, and it has to keep up with that. And that tends to go hand in hand with any kind of cardiovascular exercise you're doing. But in general, when you do your exercise, you're really conditioning your body muscles as well as your heart and cardiovascular system.
So we're not increasing the capacity of our lungs. Is that a sort of God-given amount? You're born with a capacity and that's it?
In general, yes. You can increase your capacity in certain instances. They've looked at certain athletes, such as swimmers, and people who condition themselves as swimmers from a very young age and through adulthood can have been found to have larger lung capacity. But in general, for the run-of-the-mill athletes, I'm not saying that you're just run-of-the-mill, but we generally do not increase our lung capacity in any way whatsoever. And that is really determined by, again, your age, your height, and then your sex.
So this gets back to something we're talking about now is a more mainstream approach as we age, is to not be running 26.2 miles, but to get out and walk and to move and have a more moderate form of exercise, because even though we're keeping our heart and lungs condition, we might be hurting our hips or aggravating arthritis. These are side effects of extreme athleticism, if you will. So whether I ran a marathon on a regular basis or went walking, am I getting the same long-term benefit?
Yeah, that's a very good question. And you bring up a lot of interesting points with that question.
Yeah.
I am not a exercise specialist in any means, but I think that you really have to listen to your body, I think, is what you're getting at. Everyone can push themselves to a certain limit, and certain people can go a little bit farther than others. I know someone, a friend who is in his 70s and still runs marathons and really hasn't had much issues. Whereas he tells me stories of how having so many running partners through his lifetime because they've all fallen off because of other issues. And I think that's just what it is, you can do everything to an extent. I don't think there's necessarily a limit at whatever given point in time you're at in your life, but your body will tell you when you hit that limit, if it's because of your joints or other issues that might be limiting it. Obviously some people will also develop issues with their heart and their lungs as they age, and that would also be limiting issues. But I think in general, for me, I tell a lot of my patients when they ask me about exercise, I think you should do what exercise you feel you can do to your limit, and not try to overexert yourself. But I think any kind of exercise, even if it is walking, if that's only what you can do, I think that's still better than just sitting on a couch.
It's so important that we're talking about this, because so many people think they're increasing the capacity of their lungs by working out, whether, again, sport of choice, whether it's swim, run, walk, gym, dance, so many things, cycling. There's so many things out there for us to do, but it isn't changing the capacity of the lungs. So how do we keep our lungs healthy in terms of just day-to-day living?
In terms of day-to-day living, the best thing we can do is to minimize the harm we do to our lungs. Obviously, breathing fresh air is a good thing. And if you're living in a lot of polluted air, that's not good for you, because you're introducing pollutants to your lungs that can cause harm to the lungs, as well as go systemically and cause harm in other organs. The main pollutant that you might introduce to yourself is smoking or vaping these days.
Right.
Those in general are not good for you. And so I generally tell people, if you're breathing in anything other than air, it's probably not good for your lungs.
Tell me about how do lungs filter air? What is the mechanism by which I'm sure it starts at the nose and goes through the whole, maybe discuss with us with the respiratory system, because again, there's so much misinformation out there about what our respiration performs.
Sure.
Or how it performs.
So there are particulates in the air that your lungs can filter out. We produce mucus all the time, and also the cells that line your airways. Some of the cells are called ciliated cells, and what that means is that they have cilia, which they look like, imagine like a brush head with a bunch of little spikes sticking out of them. And the ciliated cells tend to brush along the airways, and they brush upward. And so what they do constantly is sweep out the mucus from your lungs, because your lungs are producing mucus constantly, and they sweep it up so that you basically comes up and then you swallow it. Sometimes you might think about when you clear your throat, we do that all the time subconsciously. It's because you've kind of been sweeping up that stuff, it's collected, and then you just want to cough it out and you just swallow it. And so what that mucus does is it grabs onto things. It's very sticky. There's also antibacterial peptides in that mucus that helps fight infection. But for sterile particulates, such as in smog or smoking or vaping, it can capture some of those particulates. Now, if the particulates are too small, then it can actually go down and doesn't get stuck in the mucus, and it can go down to the very lower levels of your lungs called the alveoli. And if they're the right size, they can actually get deposited there. And then if they get deposited there, that's when it becomes issues, because that can cause long-lasting damage to your lungs.
And tell me about, this is a loaded question because of COVID and a completely separate issue. If you're in a high pollution area, does wearing a mask help?
It depends on the mask. Because like surgical masks that we wear, or those cloth masks that people are wearing, that doesn't really filter out these small particulates that are in smog. Okay. And so you'll see when they describe polluted air, the particulate size and things like that. A lot of that stuff is not filtered out. So certain masks may filter it out, N95s to an extent, but really some of these particulates that we're talking about can't even be filtered out by N95s. And so it's really about a matter of keeping your air clean. For example, if we have any fires here near Los Angeles, if the wind's blowing the right direction, it can really cause people with underlying lung issues a lot of complications. People feel it, and their symptoms get a lot worse. And so they have to stay inside. They have to keep their AC running, because the AC does have a filtering system to kind of scrub that air as much as they can possible to keep the particulate level as low as possible for themselves.
Yeah, so that's, and how often do you do a lung checkup? Let's say general, you go to the doctor and he puts a stethoscope against your heart and has you breathe deep breathing a few times. Is that as part of how extensive should we examine our lungs as part of a routine checkup?
So, most people will do a wellness checkup yearly, especially as we get to certain ages. And I think that's always a good screening of just going to your PCP, and they can listen to your heart and lungs. And in general, we don't do anything beyond that, as far as just having the general practitioner listen to the lungs. Now, if they hear something, then that kind of triggers downstream testing. There are certain times when we actually may do some screening for lung cancer. And this is something that is kind of has been established for a little while now, but it's still kind of considered newer on the screening side of things. And so if you've been a smoker for a while, if you've had what we call over 15 pack years of smoking, 30 pack years of smoking, and if you stopped smoking within 15 years and you're within a certain age, usually roughly around over 50, let's just say, Then in that situation, we actually would do a screening CT for you. And we do one every year for 3 years to screen for lung cancer. And so those are the really the only situation where we would actually just do it as kind of a standard thing. But it's a very subpopulation of patients who are smokers.
I'm Patricia Greenberg. You're listening to Eat Well, Live Well, Age Well on KABC 790 AM, where we talk about all things aging well. We're here with Dr. Peter Chen, Assistant Director of the Women's Guild Lung Institute and Director of the Division of Pulmonary and Critical Care Medicine at Cedars Sinai Medical Center here in Los Angeles. And we're talking about lung health. Dr. Chen, this is so interesting to me that we take it for granted because it's an involuntary response. It's an involuntary action to breathe. And I think people don't think about their breathing. They just do it. Let's talk about lung health after 60. I have a couple of questions. I mean, some things before. In the mainstream media, we hear if we quit smoking after 5 years, the lungs are pink and healthy again. Truth or myth?
It's more on the myth side. When you smoke, the particulates deposit in your lungs, and they're there. We just can't get rid of them. You know, there are certain cells in your lungs that'll gobble them up, but they just kind of get stuck in there. And so the damage that's done from smoking to your lungs is not anything ever that can be regenerated. You can slow down or prevent that progression of damage if you stop smoking, but whatever you lost from that damage is never recovered, unfortunately.
Even if, let's say, many of us in my age group smoked in high school for a couple of years, we all hopefully quit. I can't say everybody did, but around, smoke between 15 and 20 years old, let's say, and 40 years go by, is you still at risk for lung cancer?
If it's just a couple of years, obviously any smoking increases your risk a little bit, but in general, that's not considered in a range where we would put you at a high risk. Because unfortunately for people in our age group, a lot of us have tried that cigarette or two when we were younger,
right?
Because it was more socially accepted back then. But again, the damage is done. We do a lot of things when we're younger that we wouldn't do when we're older, and take a lot more risks. As we were kind of discussing with the lung cancer screening, you'd have to have a certain number of pack years of smoking before we'd actually put you at a high enough risk that it was worthwhile to do the cancer screening. And so it just depends on how much you smoked.
I'm going to throw a few terms out to you, and you can kind of answer me in the order that you feel you want to answer it. I want to ask you about, again, maybe lifelong and also age-related pneumonia and asthma. These are the two things that scare us. A lot of people seem to suffer with asthma. That's probably a whole nother afternoon that we can get together and talk about it. But just kind of the short answer of what is asthma and how do we work with it, and does it increase with age? And the same with pneumonia. I know there's a couple types of pneumonia, but can you tell us how that affects us and how do we heal from that?
Sure. So asthma is essentially, for the largest part, it's an allergic disease where your airways become very sensitive and they get a little spastic. And so that the airways will constrict and the airways get tight. They get smaller, increases the resistance in your airways, and it makes it hard for you to get air out. Along with asthma, you can have inflammation associated with that, and you can get a lot of mucus plugging. It produces a lot of mucus, and so all that stuff with inflammation, the bronchoconstriction is what we call it, and the mucus plugging, it basically plugs up your airways and makes it very hard for you to get air in and out. That tends to happen more in children. Okay. Asthma tends to come on in children, and as they grow older, it actually tends to go away. So many people, if not most of them, most children that have asthma will have not many issues when they're in their adulthood. Now, some people will carry on to their adulthood. Some people will have the onset of symptoms if they have exacerbations, something that they're allergic to, certain pollen, certain molds. If there's a lot of smoke in the air, those things might bring on their symptoms. And I've had some patients where later on in their life, their asthma came back.
Okay.
And so, but in general, asthma tends to go away as you get older, but that doesn't mean that it can't stay, and sometimes it does come back. Now, on the flip side, pneumonia is the opposite pattern. And so pneumonia can be caused by a lot of different things, as you stated. We generally think about bacterial infections causing pneumonia, but viruses cause essentially pneumonia too. There are fungi out there that can also cause pneumonia. But when we think about bacterial pneumonia, the risk of you developing pneumonia tends to go higher as you get older. And it's because as you age, your immune system doesn't work as well anymore. And so because your immune system doesn't work as well, you're more susceptible to these type of infections over time.
And why do people die of pneumonia?
So these days, we can generally treat most pneumonias. Now, there are caveats to everything. If we can catch a bacterial pneumonia early enough, we have plenty of antibiotics available that we can usually treat them. There are more antibiotic resistance now, and so that does sometimes lead to why certain people don't respond well.
Mm-hmm.
And it's largely because we overuse antibiotics because we're giving it to anyone with a cough or sneeze,
Right.
where it might be from a virus, and then over a lifetime you've developed resistance to that. And so that may be a reason why people die from pneumonia, because we don't treat it early enough, or we don't have a good hold of that bacterial infection early enough, and it can develop into what we call full-blown sepsis, where it becomes a systemic issue where a lot of the organs start having a lot of dysfunction from this infection that started in the lungs. And then that becomes kind of a snowball effect and leads to death in some patients.
Because this is unfortunately, what you hear about is people say, well, I went into the hospital for something minor, I got pneumonia, and I was very, very ill. Or you hear people, that's why I know that's another kind of loaded question, but thank you. This information is so amazing. Now, you mentioned earlier, our lung capacity does diminish with age, and can we stave that off somehow?
So lung capacity does diminish with age. It's very slow and very small, and we generally have enough lung capacity that we don't have to stave it off. As far as I know, there's not much we can do to stave off the natural decline in the lung function that comes over time, except for try to prevent harm. Again, don't inhale things that you shouldn't be inhaling that could damage the lungs. That's really the main thing we can do to prevent that. There are exercises for the lungs. We generally do that for people who have underlying lung disease as part of pulmonary rehab. You can exercise your diaphragm, learn how to do pursed lip breathing, things like that. It doesn't mean you can't do it if you have healthy lungs, and it might make you feel better, and that's great. But in general, it's probably most helpful for those that have underlying lung disease. And the honest truth is we have so much lung redundancy, you can actually live with one lung if you have to. And that's how much redundancy we have in our body from a lung capacity standpoint.
Yeah, I saw that your subspecialty, or something that you're genuinely interested in, is tissue repair and damaged tissue. So are we now able to regenerate lung tissue at all? Is that science moving along?
Currently, it's really more on the science side.
Okay.
No, we have not gotten to the point where we can regenerate a human lung tissue. That is obviously the holy grail.
Mm-hmm.
Now, there's a lot of talk about stem cells and such. We do, there's a lot of researchers, including here at Cedars Sinai, that do stem cell research, but it is not ready for prime time, unfortunately. There are no stem cells that are out there that can be used in any disease, although you see the advertisements. Nothing has been proven to be benefit as of this current day.
Amazing. Dr. Chen, we're almost at time, and I just want to say this has been so informative in such a short period of time, and there's so much more to talk about. And I'd like to ask you before we go, what do you like about getting older?
Oh, that's a tough one. I think what I most appreciate about getting older is really the perspective that we have on life.
Hmm.
Because you hear this when you're younger and you don't think much about it, but when you get older, it's really true that the perspective you have gives you a lot more insight into how to approach things and understand what's important and what's not.
Yeah, again, this is what we talk about here in our focus is getting older and being healthy as we get older. So just the quick 5, 4, 3, 2, whatever tips you have is okay, getting out and getting fresh air, getting out of the city if possible, breathing fresh air, no smoking of any sort. Does that include marijuana in your book?
Yes, that
Okay.
does include marijuana. Anything that
Anything
is
that produces smoke. Stay indoors in air conditioning during fires, and just get plenty of exercise, whatever that might be, whatever makes you happy, right?
that sounds pretty
Yeah.
appropriate.
So Dr. Chen, Dr. Peter Chen, he is Assistant Director of Women's Guild Lung Institute and Director of the Division of Pulmonary and Critical Care Medicine at Cedars Sinai's Medical Center here in Los Angeles. Thank you so much, Dr. Chen. Wonderful to talk to you about this, and we should do it again soon because there's so much more to cover. Thank you for listening to Eat Well, Live Well, Age Well on KABC 790 AM. Please tune in again for our engaging discussions on all things aging well. For feedback or show topic discussions, please email me at www.eatwelllivewellagewell.com.